Considering how, I mean, our genome sequencing here in the Philippines is pretty slow, no? Uh, how are we making sure that by the time we find out that the Omicron is here, di ba, that we're well prepared? Baka ito na naman tayo, di ba? Because as with the Delta variant, we were getting the Delta variant numbers only like 3 months after the Delta variant hit India and, di ba, all other countries. So how do we know that that's not going to happen this time, or what steps are we taking to ensure that there won't be a repeat of that, given that our genome sequencing capability has not yet really, well, let's just say, leveled up?
Okay. So siguro the way to look at it is, what does the genome sequencing do for us, no? So we don't need to sequence so many more to know that there's Omicron here, diba? We just need to sample. And with your sample, if you got the Omicron, that's it, no? Alam natin meron siya dito sa bansa. And that's really where it ends, no? Alam mo na nandito siya, ano na yung response mo? But before that, I think what we need to really understand is, it's really bound to happen, no? Papasok siya at papasok. At yung response doon is really making sure that our facilities are prepared, our LGUs are prepared. Hindi pwedeng nakalimutan na natin yung early isolation, yung pag-convert ng mga temporary treatment and monitoring facilities natin. Dapat nakahanda na po talaga yun, no? Kasi eventually it will really come. What happened with Delta, no? Hindi dahil late natin siya na-detect. It's because of our strict border control na late tayo nag-peak. Diba? Nauna na yung mga ibang bansa kasi they allowed people to come into their countries already. So they peaked very early on. Pero tayo, September na tayo nag-peak compared to, say, Indonesia, diba? July pa lang nag-peak sila. So hindi dahil, late ba natin nalaman yung Delta? No. Alam natin nandiyan siya, pero dahil ang medyo tight yung border control natin, hindi mo na siya nakapasok, no? And nung pumasok siya, then it follows your progression, nadadami yung kaso natin. So ngayon, Omicron, what is how should we prepare, no? So it's really like last time, di ba? Ang preparation is, meron tayong mga oxygen tanks, meron pa tayong mga lugar na magpapahiram ng health workers from one place to another, di ba? Alam na ba natin yung mga telemedicine, no? Nakaset up na ba yun para if people feel symptoms, may tatawagan na sila, hindi sila matatakot mag-flood sa hospital. So those are the preparations that we really need to do now.
Yeah.
It will come, it's bound to come, but hopefully this is our fourth practice, no? Going into the fourth practice, we should know what works.
Right.
And the preparation is really about, of course, aside from minimum public health standards, is getting the health system ready.
Dr. Ho, actually, medyo marami ka nang napahapyawan sa tatanungin ko, but I just want to push it a bit. Kasi kanina nga, we opened with how does the virus compare to Delta when it first emerged. Now we want to get into how is our response right now compared to our readiness when Delta emerged. Now you mentioned a lot of things, but I'm not sure if kung patanong yung sinasabi nyo, kung recommendatory yung sinasabi nyo, or you're saying at least na practice na natin as far as responses and needs are concerned, these things are in place already. So siguro din na lang yung tanong ko, compared to when Delta was finally acknowledged as a variant of concern, how much more ready are we now?
I would think, no, sir, in my opinion, in many more LGUs, we are more ready than ever. But we also need to recognize that our health workers are tired. Right? They've been doing so much. Konting pahinga, then vaccination ulit. Konting pahinga, then eto na naman, no? So yun yung pakiusap natin sa general public. This is going to be a good Christmas, no, for all of us if we really work together. We already know what the risk factors are going to be, what the risky activities are going to be, and if we can help, no, by being responsible, mabakunahan lahat ng pamilya natin, katrabaho natin, that's already going to be so much plus point, no? Yung time na nag-surge tayo, last time around, from August to September, mas mababa yung vaccination coverage natin. Ngayon, we're going into this with what? More than 40% fully vaccinated Filipinos. Let's use the next 2 days and then the next run of the Bayanihan Bakunahan to really ramp up and make sure bakunado na lahat ng seniors. No? Ngayon, nasa medyo 70% tayo ng seniors. Tapusin natin sila. If we do that, we are in a much, much, much better position to start off this response with Omicron.